Low back pain, let's answer your questions. It's the most common reason we get a call at the chiropractic office. It's very common stuff. I want to talk about some cases of lower back issues people have come in with recently. I want to answer the main question that you have because I've had some great questions coming in from patients recently, so it prompted this video. Here's the things that we want to address on this video. Number one is we want to talk about what's wrong. What is wrong with your back and what's causing your pain? Next up, can we help? Can chiropractic help in all of the other lifestyle recommendations that I work on in the office? Number three is how long is it going to take? We're going to answer that. Number four, home stretches. What should you be doing and not be doing? Number five, ergonomics and lifestyle changes that will help you get through your pain issue that you're having right now and make sure it doesn't come back, or do our best to make sure it doesn't come back. Number six is nutrition and supplements, how that can relate to low back pain. Number seven is something that's not talked about when it comes to any spinal pain around the body, any pains at all. Stress. So we're going to address that. That's what we're going to be talking about here, okay? The first thing is before I get into what's wrong, is the medical disclaimer is anything I'm giving you here is not medical advice. If you have any questions about a condition that you're having, you have to talk to your doctor first. Don't try anything that I am recommending here until you talk to your healthcare practitioner or your doctor first. And we are not forming any doctor-patient relationship by giving you this information that I'm going to give you in the video. What's wrong? In almost all cases, and in a moment I'm going to talk about a 70-year-old woman, a 50-year-old woman, a 22-year-old woman, and a 45-year-old man coming with back pain of different scenarios and so forth, and we have to talk about what's wrong, okay? What's wrong? In almost all cases, it's disc pain. The discs are the cartilage pads between the bones in your lower back. That is almost always the generator of pain. There are some exceptions, but that's almost the generator of pain, and you're going to see in these four cases it definitely was, and that's the most common thing that we see. So then we have to get into our evaluation. So I do the history, the chiropractic evaluation, orthopedic test, neurological tests, maybe x-rays, maybe MRI. We get into the evaluation portion of it to see if that tentative diagnosis is correct, okay? So that's what's wrong. Then we look into alignment, and part of the case with alignment will give us an insight into what exercises are good for you and what exercises you should avoid. And that's why if Sam comes in, he finds that certain exercises and activities are good, but if Sally comes in, she might find if I try those bother me, but if I do something different or even opposite, they work for me. If somebody comes in and they said, I've tried these treatments and I've tried chiropractic and physical therapy and yoga or whatever, and it's not working, we do evaluation, maybe take x-rays, and we see a leg length discrepancy that's been overlooked. Maybe we need to correct that. Maybe there's things in the lifestyle that we're going to get into a little bit down the road, okay? So that's typically what's wrong. A few examples recently of what came in. A 70-year-old female comes in to see me, worst pain ever. She's been a patient of mine off and on over the years. She comes in and she'd called the office, said, I've got a back pain flare up. I'm going to come in, I'm going to have somebody drive me. Okay, she comes in a walker. I've never seen her in a walker. She's got terrible pain down her leg, could barely put any pressure on it, okay? And this is a message for you at home. I do a brief evaluation. She could barely even sit on my table, and I knew this was beyond me. She couldn't sleep for days. I didn't know this until she came into the office. We sent her immediately to her doctor's office, which she had an appointment later that day. Anyways, they shipped her right to an ER, which was completely appropriate in her case. Things weren't helping her and touching her. So long story short, she's going to do fine. She actually does not need surgery. She did well. She just needed some medications to get her over the hump. And now she's doing some better, so we'll be able to take over shortly in her care. She had a disc problem. Very likely she had a disc herniation. People can have disc herniations with no pain, or you can have disc herniations in her case with terrible 9 to 10/10 pain driving down your leg. Okay. So in her case, we decided chiropractic was not her route, it was a medical route. Then we have a 50-year-old female coming in recently, had off and on back pain for a couple of years, and it wasn't getting any better. Had tried some therapy, tried some chiropractic, I even had an MRI shortly before arriving in my office. I decided to take a different route with my chiropractic techniques, and luckily, right after the first visit, before she left the office, she said, I feel a little bit better. She comes in for visit number 2. She says, it's sustained, and this is pretty cool. Not a ton better, but a little better, and she was just happy to feel a little bit better, like anybody would in that situation, right? So we did a little bit more, and then I got her MRI images. I went over the images with her, and we found out in her case that she doesn't have enough curve in her lower back. Her back is straighter. So now we're going to give her some activities to build the lower back curve in there. And as a little side note, some people are stomach sleepers and comfortable that way. Other people like myself, if they try to sleep on their stomach, it bothers them. There's different reasons for that, but in one case, if somebody has a flat back, not enough curve in their lower back, and they lie on their stomach, it increases the curve in their lower back, and it actually feels good. Someone like me with an already increased curve in their lower back, they lie on their stomach, and it actually makes it worse, so we don't sleep that way. You can see, you can start putting pieces of the puzzle in here of what's wrong and then what we can do. So she's early on in the process, but she's happy, and I'm happy to see that she's getting some relief in a couple of visits. But her home methods, techniques, exercises, and so forth are going to be different than the next person, and I came in with some different chiropractic techniques. Next, with a 22-year-old woman that comes in to see me. She had been a patient of mine in the past. I hadn't seen her in a few years. She was off to college. She had some back pain in her past, in her history, but she was pretty good for a couple years. Then comes to see me. She says, I think this is the worst back pain that I've had. And it seems to be worse this past week. No injuries, clean history, nothing, so no slip and fall or anything like that. It just kind of came on fairly quickly. No leg pain, no change bowel or bladder function. But she says, at the end of the workday, I'm getting like burning pain like at 8/10. I'm like, okay, let me work on you. We gave her the weekend. She comes back in and she said, I had some good relief, knocked it down to like a 3. First day back in work, right back to an 8 or a 9 burning pain. I said, okay, x-rays. Good thing we took x-rays, 22-year-old, no injury, no slip or fall. She has a pars separation. You're gonna have to look this up. She has a pars defect, pars separation of one of the bones in her lower back. She has a spondylolisthesis of L5 on S1 with spondylolysis, which means pars defect. She literally has a crack in her bones, which allowed the bone to slide forward, causing disc irritation. Now that's a problem. Off to the orthopedic she's going. Don't know what's going to happen there. Might be a back brace. We'll see. But again, that was in case that x-rays, you sometimes have to make that call and take them. We wouldn't have known without some x-rays, and then it's probably going to be additional follow-up, maybe some additional x-rays, maybe an MRI and so forth, and then we'll determine treatments. See how these things can be quite a bit different as time goes along. And then a 45-year-old man comes in, low back pain flare-up. He had it for a couple of months. Then he finally ends up in my office because it wasn't getting better. And we start working on him. He's been a patient of mine in the past. We start making some gains, but then he had a flare-up. And then he made some gains, and then he had a flare-up. And I had to go into it with him, and I said, what's going on? What are we doing? And so forth. We found out he was working out too heavy in the gym. And so he was going 2 steps forward, a step and a half back. 2 steps forward, a step and a half back. So we finally came to agreement, okay, we're going to back off on these exercises, let this heal, and then we go along. So back on our list here, when I talk about what's wrong, to wrap your head around it, I've oftentimes talked to patients about a sprained ankle. When you have a freshly sprained ankle, that ankle is going to tell you, you can do this, but you can't do that. Let's say you're a runner, you sprain your ankle, and you want to get back running as soon as you can. You know that if you run too soon, it's going to flare it up, you're going to lose more time. So you have to walk before you can run. And then if you walk 20 minutes, that's okay on the sprained ankle, that's improving. But if you walk 45 minutes, it kind of swells up again, it gets a little bit worse, and so forth. The sprained ankle will tell you, do this, but don't do that, and that was too much, and this is just fine. Your sprained back, your back with your disc irritation, or even your neck, you can pull your neck into this too, is going to tell you the same thing. Do this, but don't do that. Think sprained ankle, think sprained back, and you'll think about what to do. And of course, that home scenario that you should already know, what are you going to do for that swollen ankle? You're going to put ice on it. What are you going to do for that irritated back? You're going to put ice on it. Follow? Okay. So, number 2, can we help? Well, you can see from a chiropractic standpoint now, we have to make assessments on here whether we can help or not. And you can see in these cases, some of them absolutely, some of them might come back into me depending on other procedures that they might need. And we make that determination, are we going to be able to help or not? We figure that out relatively quickly in the process, okay? So that deals with that. Number 3 is, how long is it going to take? Well, of course it's going to be different for different people. We take a bunch of people with sprained ankles. Some of them are going to be mild and get better in a couple of weeks. Some of them are going to be moderate, maybe they're going to take 4 to 8 weeks. Some of them are going to be more complicated and they're going to take some months. Same thing with backs. You've heard me do shows in the past where some people have had an old chronic arthritic degenerative condition which might even take years before it gets better. Now that's on the other end of the bell curve. Most of the people fall in here. Most of you are going to fall in the several weeks to a few months bulk of what needs to be done. Sometimes we get lucky and a couple of visits or a week or two are better. Sometimes people fall on the far end of the curve where it's going to take a few years before they're going to get better. But as long as we're trending in the right direction, we can make sure that that is effective. Home stretches. We've talked about home stretches a lot. We've talked about workouts a lot. We want to get people into stretching and into workouts again as soon as they possibly can. But remembering the sprained ankle scenario again, if you go back to activity too soon in that sprained ankle, it's going to flare it up and you're going to lose some ground and lose time. So we want to funnel our way and find our way here where we're not doing nothing. And we want to be introducing stretches and working out when we can, but appropriately so we're not flaring it up, okay? Home stretches, I've done shows on it. You can go to my video page if you want to check that out, or the other shows that I've done here on Health Source, so you can look that out. We start stretches, if appropriate, on day 1, so we can get people moving as soon as we can. Number 5 is ergonomics and lifestyle. So I had to go into that with a patient today. This is something we talk about all day long in my office. Many people have a sit-down job. We have to manage the sitting position. That's what I mean by ergonomics. Other people have lifting scenarios. I have school teachers that are bent over low desks working on children or daycare folks, and they are bending over a lot. So we have to change that. We have to get them stools or some other way of managing the position so they're not bent over like this for sustained periods of time. They have to get lower down with the kids and so forth, okay? So we have to change the ergonomics. We work with people in the trades, so we're lightening up their tool belt if necessary. They're getting assistance for things that they typically would do on their own, whether it be landscapers or contractors or whatever. So we work our way through heavier labor activities to see if we can change some ergonomics. And then of course we have people doing stretches in the morning and stretches at night. I've done shows on pulling laundry out of the washer that flares up certain backs, handling children, cleaning the house, vacuuming, shoveling, mopping, water at the grocery store. We've even done some things on that. We have to change all these ergonomics, but managing the sitting position has been absolutely critical. Number 6, yes, nutrition and supplements. Why? So if we have an inflammatory diet, the SAD diet, the standard American diet, SAD diet, inflammatory diet, you have a chance of having more pain overall. You have a chance of inflaming your joints, slowing down the process, and accelerating arthritis. There's anti-inflammatory nutrition, of course, it's just eating real food. And then there are certain supplements that can absolutely work on this process. I've talked before about Dr. Joseph Maroon, the orthopedic surgeon, who took a bunch of people with chronic low back pain and knocked down a bunch of it, like 80-something% of it, 87% if I remember correctly, with omega-3 fish oil. That's not the only supplement that I would recommend, but you can see where if you start to change the inflammatory markers and blood work and so forth by adding certain supplements in there, that can help you as well. So there's quite a laundry list of things that we can do. And lastly is stress. Again, if you're in a chronic state of low-level stress, that's going to release chemicals that sensitize your pain nerve endings around your body. I can't tell you how many people come in and say, my neck is flared up, what's going on? More stress. My back is flared up, what's going on? More stress. My sciatica, my carpal tunnel, my headaches and migraines and clusters, whatever it might be, is flared up with stress. We've done lots of shows in there, and there's wonderful information out there on handling chronic stress in a better way. So here's a list of things that you can work on when it comes to your lower back and also your neck. I'm Dr. Scott Fuller.